it may be that it's already too late.
That's Beatrice Pickup reporting. The time now is 22 minutes to 1. You're listening to You and Yours. If you're being treated for thyroid disease and you live in England, your treatment might be about to change. NHS England wants to shift people from one very expensive drug to another much cheaper one, because most people can take the cheaper drug. The cheaper medicine is called levothyroxine, or T4. A listener, Kate Heath, wrote to us about it. She lives in Hertfordshire, and she takes the more expensive treatment. It's called liothryonine, or T3.
I'm really scared because this is a drug that I've relied on to keep me well for 10 years, and now it's being withdrawn. I was really poorly before I got T3, and I'm scared about what's going to happen, quite honestly. I'm going to have to look into trying to source it privately, I think, or look at other alternatives. I'm not sure what's even out there, but it seems as if it could be very expensive, or it could mean buying from abroad, and that worries me because I'm not convinced that I would know what I was getting. I was warned by my thyroid specialist a couple of months ago that this could happen and that I should start looking for alternatives. And I've heard that people have already had prescriptions refused and stopped for T3, even though the proposal only came out last week. And as far as I know, it's still up for consultation. But it is happening already that the drug's getting withdrawn.
That's Kate Heath. So should she be worried? Earlier I spoke to the Chief Clinical Officer and Co-Chair of NHS Clinical Commissioners, Dr. Amanda Doyle, and I asked her what's happening with these two drugs.
What we're doing is looking at a range of quite difficult choices about how we prioritise spend in the NHS. We've got a limited budget, we've got a responsibility to make the best use of the money we've got. And so we've identified a range of medicines that for various reasons are less of a priority. And one of the categories we've looked at are things for which the same clinical benefit can be made available using a much cheaper medication. And one of these is for the treatment of hypothyroidism. So the vast majority of patients are treated perfectly well on levothyroxine, which is much less expensive than liothryonine. This isn't a blanket ban.
Now, Katie, our listener, has been warned by her specialist that she will be taken off a drug that she feels really suits her and that she trusts. And she knows of cases where GPs have already stopped giving this drug, T3. Should they have stopped already?
We're not asking everybody to stop prescribing already. What we are doing is looking at consulting with a range of groups of patients, with local CCGs, with specialists, before we agree the way forward. If an individual specialist feels the patient doesn't need to continue to take it, then they may well take the decision to stop the medication sooner.
Is there any penalty for the GP if they go on prescribing this T3 or the specialist in hospital?
No, not at all.
We spoke to the charity Thyroid UK. They confirmed that people have been taken off T3 already and are starting to buy it privately. And they're also concerned about the way the cost of this drug has shot up in recent years. Here's the Chief Executive, Lynn Minot.
There are hundreds of people in this predicament. We know that clinical commissioning groups are stopping patients via their GPs. So patients are being taken off of the T3, and they're also being stopped from starting it in the first place. The cost of T3 now is more than £250 for 28 tablets. The manufacturers have increased the price drastically over the past few years, and as we all know, the NHS don't have unlimited funds, and this is one way of saving money. What people are doing is purchasing it online, or they're getting a private prescription from their GP and obtaining it via a wholesaler here from Europe, where the same drug is 30 or 40 euros. You know, patients shouldn't have to pay for a drug that makes them well.
That's Lynn Minot. Dr. Amanda Doyle, thyroid disease is a tricky one in that it affects your whole body, doesn't it, your metabolism, and people who have thyroid disease, they can struggle for a long time to find exactly the right drug for them. You can understand why people are anxious if this is being interpreted as a blanket ban, whatever you intend.
We don't intend to make people anxious. Thyroid disease can be complex, that there are a whole range of symptoms, some of which are quite vague, and lots of the symptoms can also be attributable to other conditions. But one thing about thyroid disease is that it is easily measurable with blood tests. There are blood tests available which measure the degree of deficiency or overactivity of the thyroid gland, and we usually treat to blood tests as well as taking the symptoms into account.
The Competitions and Markets Authorities have been investigating drug price rises. In the NHS, the price of branded medicines is controlled, but when there's only one manufacturer of these older, off-patent drugs, some of the prices have been hiked. Is that what's happened here?
Certainly the price of liothryonine to the NHS needs to be looked into. The NHS is paying probably 40 or 50 times the price for 100 tablets that you can buy these tablets for in most of Europe, and so it is a significant issue for us.
What can be done about it?
That would need to be looked into in conjunction with the pharmaceutical companies.
That was Dr. Amanda Doyle, the Chief Clinical Officer of NHS England's Clinical Commissioners. Now, back in the day,